are Southeast Senior Services, which is a division of Catholic Community Services. I also manage the Lending Library and the Resource Center, and I'm also the facilitator for the Juneau Parkinson Support Group. So we're really excited that tonight is our last night. We've had 3 webinars. This is National Caregiving Month, and so our caregiver speakers is going to finish up with Jeanné. I'm sorry, Jeanné Larson, and she's from the Medicare office, and she's going to give us a presentation called "Need Help Through the Maze" about Medicare. So why don't you go ahead and take it away?
Thanks, Denny.
Okay.
Hi, everyone. Welcome to this presentation on the Medicare 101. I'm Jeanné Larson, your presenter this evening. I do want to mention that on every Medicare Information Office presentation, we have an opportunity for you to complete a survey. It's a satisfaction survey that can be completed whether you're attending live or watching this as a recording. The information will help us to better deliver the best possible services to people with Medicare in our communities. I will have instructions for completing the survey after my presentation. And of course, if you have any questions about the survey, you can always contact the Medicare Information Office. The Medicare Information Office is housed in the state of Alaska Department of Health, the Senior and Disability Services. We are Alaskans helping Alaskans get more out of their Medicare. And though we're a state-based agency, funding for our office comes solely from 3 federal grants, which are provided through the Administration for Community Living, also known as ACL. The State Health Insurance Assistance Program, or SHIP grant, focuses on providing free, unbiased, one-on-one Medicare and health insurance counseling to Medicare beneficiaries or their authorized representatives. SHIP also offers community outreach and group education to the public about Medicare. The Senior Medicare Patrol, or SMP grant, helps to empower and assist Medicare beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse through outreach, counseling, and education. Last but not least, the Medicare Improvement for Patients and Providers Act, also known as our MIPA grant, provides funding to help Medicare beneficiaries who have limited income and limited resources apply for assistance programs with their Medicare costs. Every state and U.S. territory has a SHIP, SMP, and MIPA program, but depending on the state, it can be called something different, like SHIBA, SHINE, or here in Alaska, the Medicare Information Office. All these programs depend on recruiting and training volunteers to be a boots-on-the-ground effort in providing education and outreach about all things Medicare. The Medicare Information Office is a small but mighty staff of 4 state employees located in Anchorage. Dana Norwood is our program coordinator. I'm Jeanné Larson, the project assistant. Terry Pfister is our volunteer coordinator, and Teresa Garfield, also known as T, is our office assistant. T answers our busy statewide helpline and puts our callers into a call queue so that certified Medicare counselors can return phone calls in the order received and hopefully as soon as possible. There are currently over 110,000 Medicare beneficiaries in the state of Alaska, and about 10,000 people aging into Medicare across the nation each day. So you can imagine the need for our services. The Medicare Information Office also takes some of our grant funding and funds agencies to house certified Medicare counselors. We also partner with statewide organizations who can provide accurate and authoritative Medicare information to their community. By working with these grantees, partners, and volunteers, it enables us to have a much larger reach throughout the state of Alaska. The Medicare Information Office currently has over 100 volunteers in our program. Some are what we call in-kind volunteers, meaning their job duties require them to know and understand Medicare. We also have true volunteers. These volunteers do not work for a grantee or partner agency, but out of the goodness of their heart, volunteer their time and energy to our program and helping Medicare customers. We have different volunteer roles, such as disseminating information, providing Medicare counseling as a certified Medicare counselor, and presenting Medicare education, just as I'm doing now. We're currently recruiting for volunteers all over Alaska. Some qualities that we look for in a volunteer include good communication, active listening, the ability to complete the necessary training for the position, a willingness to learn, and an enthusiasm to work with diverse backgrounds. If you or someone you know is interested in learning more about our volunteer program, please contact our office by phone or email. Our contacts are provided at the end of the presentation. Now let's get into the basics about Medicare that you've been introduced to our office. Medicare currently provides health insurance for over 110,000 Alaskans. So what is Medicare? Well, Medicare is health insurance primarily for people who are 65 and older. That's about 80% of the Medicare population. And those who are under age 65 who've been determined disabled by the Social Security Administration and receive a benefit called SSDI, Social Security Disability Insurance, for 24 months. This can also include those who have been diagnosed with ALS, also known as amyotrophic lateral sclerosis, or Lou Gehrig's disease. Those who qualify for Medicare based on ALS do not have the 24-month waiting period, and their Medicare starts as soon as they qualify for those disability benefits. Also, those people of any age who qualify based on end-stage renal disease. This is also referred to as ESRD, which means a person requires a regular course of dialysis or needs a kidney transplant. The Medicare and You handbook, pictured here on the slide, is mailed to every new Medicare beneficiary and to each Medicare household every year in the fall. You can also access the Medicare and You booklet electronically at the federal Medicare website, which is medicare.gov, like medicare.gov. This booklet is important to understand and read, as it explains all things about Medicare and provides information about health and drug plans in your geographic area. There are two main federal agencies you should be familiar with in regards to Medicare. Social Security is responsible for enrolling most people in Medicare. Social Security also maintains your personal information, such as your name, your date of birth, and address, and then sends these details to Medicare's records. So if any of your personal information needs to be changed or updated, you can update it one of two ways. You can create a personalized, secure online My Social Security account at socialsecurity.gov, like government, or you can call Social Security's national phone number or any of the local Social Security field offices. Medicare coverage and benefits are administered by a separate federal agency called the Centers for Medicare and Medicaid Services, also known as CMS. To get coverage and benefit information, you can create a separate personalized account. This is different from your Social Security account at the Medicare.gov webpage. The Medicare.gov tool helps manage the claims when Medicare pays for a service. You can look at your prescription drug plan if you have one, other health insurance that Medicare may have on record, and get access to your preventive benefits, such as when you last received the preventive service and when you're due for that service again. If you're not computer savvy or you don't feel comfortable navigating the online tools, Medicare is available 24 hours a day, 7 days a week by calling 1-800-MEDICARE. That's 1-800-633-4227. Remember, that's 24 hours a day, 7 days a week. Now let's talk about Medicare enrollment. When should you do it? How should you do it? So if you're already getting Social Security benefits at least 4 months before you turn 65, you will actually automatically be enrolled in Medicare Part A, which is called hospital insurance, and Medicare Part B, which is called medical insurance. And you should expect to receive your Welcome to Medicare package, which includes your Medicare card and a booklet about some Medicare basics. And this arrives about 3 months before the month in which you turn 65. And then your Medicare coverage is set to begin on the first day of the month that you turn 65. There is an exception to this, and that is if your birthday falls on the first day of the month, your Medicare coverage will actually begin the first day of the month before your birthday month. If you're under 65 and qualifying for Medicare due to a disability, you should expect to receive your Welcome to Medicare package and get A and B after receiving disability benefits for 24 consecutive months. Your Welcome to Medicare package arrives 3 months before the 25th month of your disability payment. And your Medicare starts on the first day of the 25th month that you receive that SSDI, Social Security Disability Insurance payment. The Welcome to Medicare package is the same for anybody, whether you're turning 65 or on Medicare due to a disability. It is a red, white, and blue Medicare card and a basic booklet about Medicare. Both of those documents are shown here on the slide. If you're not getting Social Security benefits at least 4 months before you turn 65 and you want to sign up for Medicare, you will need to take action to apply with the Social Security Administration. You don't have to be getting Social Security benefits to get Medicare. You can enroll online at the socialsecurity.gov website or call the national or local field offices to set up a telephone or in-person appointment. After Social Security completes your Medicare application, you should expect to receive a Welcome to Medicare package in the mail, which again includes that Welcome to Medicare booklet and your Medicare card. Now let's take a look at the Medicare enrollment periods. These are really important to understand to make the best timing decisions and have coverage when you need it. You can first sign up for Medicare Part A and or Part B during the initial enrollment period. This is also referred to as the IEP. If you sign up for Part A and or Part B during the first 3 months of your initial enrollment period, in most cases, your coverage begins on the first day of your birthday month. However, if your birthday is on the first day of the month, remember, there's that exception, your coverage will begin the first day of the prior month. If you enroll in Part A and or B the month that you turn 65, or during the last 3 months of your initial enrollment period, the start date for your coverage can be delayed 2 to 3 months. This is the current Medicare law through the remainder of 2022. So as you can see, the later you enroll, the later your Medicare coverage starts. If you miss your initial enrollment period, you could face late enrollment penalties for not signing up when first eligible. We're going to focus a little more on that as we get into some more enrollment periods and costs with Medicare. A very important change to Medicare enrollment periods starts in the new year. Important upcoming changes and rules for the 2023 year and later are as follows. If you sign up for Medicare in any of the 3 months prior to your birthday month, your Medicare coverage will start the first day of the month in which you turn 65. But the new rules now say to make understanding these enrollment periods easier, beginning January 1 of 2023, if you sign up during the month you turn 65 or during the last 3 months of your initial enrollment period, your Medicare coverage for Part B medical will no longer have a delayed start based on the month in which you enroll. Now, simply, whatever month you sign up, your Medicare Part B medical coverage goes into effect the first day of the next month. So, for example, if you apply in your birthday month, it starts the month after. If you apply in the month after your birthday month, it starts the next month after that month in which you apply. This has made it a lot easier to explain when Medicare coverage begins and to make sure that people do not have further delay of their Medicare benefits starting. So there's always an exception, it seems, when it comes to Medicare's rules. The exception to an initial enrollment period is increasingly more common as people or their spouses work past age 65. So there's something called a special enrollment period. And the special enrollment period says if you or your spouse is still actively working and you have a group health plan through that current active employment, you can choose to delay Medicare Part A hospital insurance and or Part B medical insurance during your initial enrollment period. A special enrollment period allows you to enroll later and not face a late enrollment penalty. If you qualify for a special enrollment period, you can sign up for Part A and or Part B anytime that you're still covered by the employer group health plan, or during an 8-month period that begins the month after the employment ends or the health insurance ends, whichever happens first. If you do not enroll in Medicare within that 8-month period, you will have to wait until another enrollment period, which we'll focus on next, called the general enrollment period. You may have a gap in your coverage, and you may pay late penalties. It's important to understand to qualify for a special enrollment, you have to have those 2 factors combined: current active employment and health insurance through that active employment. So It's important to note policies like COBRA, a continuation of the employer plan, though work has ended, retiree coverage from a former employer or your spouse's former employer, Veterans Affairs, also called VA, and Indian Health Service, also called IHS, are not considered to be from current active employment, and so those types of benefits do not qualify you for a special enrollment period. So let's say you didn't sign up for Medicare during your initial enrollment period, and you don't qualify for a special enrollment period based on active work. You can enroll during what's called a general enrollment period, also called the GEP. The general enrollment period happens every year, January 1st through March 31st. And this is also a new law that starting January 1st of 2023, if you enrolled during the general enrollment period, your Medicare coverage starts the first day of the month after the month in which you sign up. In addition, if your coverage, if it has been more than 12 months since you were eligible but not signed up for Medicare, your monthly premium will go up 10% for each full 12-month period that Social Security can count. So if you go 12 months without Medicare, it's a 10% increase. If you go 24 full months without Medicare, it's a 20% increase. And that keeps going up. There's no cap on it. And that percentage is based on whatever the premium is for Medicare that year that you sign up. And it's a lifetime penalty for the Part B medical coverage. So remember, this doesn't apply though if you qualify for that special enrollment period based on having health insurance through your or your spouse's current active employment. All right, so now let's focus on what exactly are the parts of Medicare and what does it cover? First, Part A is known as hospital insurance. You can kind of think of this as your inpatient benefits. It covers medically necessary inpatient hospital care, skilled nursing facility care if you need to transition from hospital to a skilled facility, hospice care if your doctor certifies you need end of life, palliative pain care because you have a terminal illness, and home health care if you need intermittent skilled care at home. All Part A covered services. Part B is where most everything else falls. Part B, known as medical insurance, covers medically necessary doctor visits, including a general practitioner or a specialist, outpatient medical services, laboratory, durable medical equipment, also called DME, diabetic testing equipment and supplies, preventive services. Some home health services can also be covered under Part B, depending upon some circumstances. Outpatient physical therapy, occupational therapy, and speech language pathology. You can find a list of Medicare covered services in that Medicare and You handbook I mentioned earlier. For those of you that are computer savvy, you can also visit medicare.gov on the web, or if you like to call, 1-800-MEDICARE is available 24 hours a day, 7 days a week. Also, if you like accessing information on your smart device, such as your phone or your tablet, you can also download an app that's called What's Covered. And this is available both in the App Store and Google Play. Let's take a look at Medicare costs. So you don't pay a monthly premium for Part A coverage if you or your spouse paid enough Medicare taxes while working. This is often referred to as premium-free Part A. The Federal Insurance Contributions Act, or FICA tax, is the United States federal tax that funds Social Security and Medicare. About 99% of people with Medicare don't pay a Part A premium because of working at least 10 years in the United States and earning 40 credits, or sometimes referred to as quarters in the past. If you're not eligible for premium-free Part A, you can still buy it. Social Security determines if you must pay a premium. They look at your earnings record. And if you aren't eligible for premium-free Part A and you don't buy it when first eligible, your monthly premium can go up 10%. Now, that premium penalty isn't a lifetime penalty. For Part A, you actually pay the penalty for twice the number of years you should have been enrolled, but were not. So for example, if you went 1 year without Part A, you'd pay a 10% penalty for 2 years. If you go 2 years without Part A, you pay a 10% penalty for 4 years, and so on and so forth. When you receive medically necessary inpatient services covered under Part A, this chart explains what you must pay out of pocket. So the Part A hospital inpatient deductible is based on something called a benefit period. There's no limit to the number of benefit periods you can have. In 2023, the Part A deductible is $1,600 per benefit period. So what is a benefit period? Well, this is a means of measuring the way Medicare looks at your use of hospital and skilled nursing facility care. A benefit period begins the day you're admitted to the hospital as an inpatient or skilled nursing facility. The benefit period ends when you haven't gotten any Medicare covered inpatient care for 60 days in a row. Now let's look at Part B, medical. Everyone pays a premium for Part B. The monthly premium is usually deducted automatically from the Social Security benefit. If you don't get Social Security when you sign up for Medicare, the default method is you'll receive a bill in the mail from a place called the Medicare Premium Collection Center, and that's usually billed every 3 months, so you make a quarterly payment. The monthly Part B premium in 2023 is $164.90. However, Medicare Part B premiums can be higher if your modified adjusted gross income is above a certain amount. Then you pay something called an income-related monthly adjustment amount, or IRMA premium. Most people will pay the standard Part B premium, but roughly about 7% of people with Medicare will pay a higher amount based on that higher income. The total Part B premiums for people with higher incomes are shown on this slide based on the tax filing status. When you sign up for Medicare Part B, there's an automatic process that happens. Social Security will automatically request your most recently filed income tax return from the Internal Revenue Service. And this is usually your tax return from 2 years ago. You should expect to receive a letter from the Social Security Administration regarding your Medicare premium amount each year. If you must pay that higher amount for your Part B medical premium and you disagree, for example, maybe your income has gone down or you stopped working or had a life-changing event, the letter from Social Security will explain how you can request a new determination on your premium. Social Security will automatically redetermine this premium each year by requesting your new income tax return from the Internal Revenue Service. This chart shows you the Part B costs for 2023. As you can see, in 2023, when you have Medicare Part B covered medical services, you're responsible for a Part B deductible, which means you pay the first $226 for your medical costs. After that $226 is met, you are responsible for 20% of the Medicare approved amount. And this is called your Part B medical coinsurance. Medicare pays the other 80%. So we just reviewed the 2023 Medicare Part A and Part B deductible and coinsurance costs. So you can see Medicare doesn't cover 100% of medical costs. And in that sense, someone may want to add on a supplement medical policy. A Medicare supplement insurance is also called Medigap because it does just as the name says. It covers the gaps in Medicare. Medigap policies are sold by private insurance companies, and they help to cover your share of the Medicare costs. Medigap policies are identified by alphabet letters, and they're standardized, meaning as long as you're looking at the same alphabet letter, the benefit design is always the same. It has to be by federal law. Each of these standardized plans has a set of benefits that are the same for any insurance company. The only difference is the company, what their customer service is like, and the monthly cost that they choose to sell that policy at. Each private insurance company decides which of the Medigap alphabet letters they want to sell. The state of Alaska Division of Insurance reviews, approves, and regulates these Medigap companies in Alaska. All Medigap policies cover a basic set of benefits. Here is the chart showing each plan letter design and the benefits covered. The state of Alaska Division of Insurance publishes a Medigap supplement rate guide for Alaska, which is updated each year with tips on how to shop for the Medigap plans, the insurance companies approved to sell in Alaska, and which of the plans A through N the insurance companies choose to sell. If you would like a copy of the Alaska Medigap rate guide, you can find it online at the State of Alaska Division of Insurance website, or you can request a copy with the Division of Insurance or the Alaska Medicare Information Office. We're happy to send that by email or postal mail, whatever your preference. So do I need a Medigap policy? Well, there's a few things to consider. Medigap policies only work with original Medicare, Part A and Part B. You have to have both in order to get a Medigap policy. If you have other coverage that supplements Medicare, such as a retiree plan or a union coverage, you might not need Medigap. If you don't have other insurance, consider whether you can afford Medicare deductibles and co-payments and weigh this against how much the monthly Medigap premium costs. There is a best time to buy a Medigap policy. And usually this time is during what is called your Medigap open enrollment period. This period begins the first day of the month in which you are 65 or older and enrolled in both Part A and Part B. It's really your Part B effective date that's going to start that 6-month period. The Medigap open enrollment period gives you the guaranteed right to buy a Medigap policy. This means the insurance company can't refuse to sell you a policy they offer or charge you more for a policy than they charge someone with no health problems. After your Medigap open enrollment period ends, what we say at the Medicare Information Office is you're at the mercy of the market. That means the insurance companies get to decide if they want to sell to you or refuse you based on age or health conditions. You can buy a Medigap policy anytime a company agrees to sell you one. However, the insurance company can place restrictions on your policy, like a waiting period for pre-existing health conditions. So keep this in mind. If you want a Medigap policy, best time to buy is when you're 65 and new to Medicare. Another part of Medicare to be familiar with that you may have already heard about as we get all these wonderful commercials on TV is called Medicare Advantage, also known as Part C or MA plans. These are offered by private insurance companies approved by Medicare, and the companies must follow rules set by Medicare. If you join a Medicare Advantage plan, you still have Medicare, but you get Part A and Part B coverage from the private insurance company. Medicare Advantage plans haven't really been available in Alaska for many years, but we do get all the commercials on TV. Most of you have probably seen the commercials that consist of a celebrity saying that you should get all the benefits that you deserve, or you may be able to get money back in your Social Security benefits. And these policies are very attractive for that reason because they can offer additional benefits like dental, vision, audio, gym memberships. And although we get those national commercials, we currently do not have any of the Medicare Advantage plans that offer additional benefits here in Alaska. Alaska does see a less common type of Medicare Advantage plan, which is called a Medical Savings Account, or MSA. And this is a plan that combines a high deductible health plan with a medical account where there's money put into the account that you can use for qualified medical expenses. However, you're not eligible to sign up for the medical savings account if you have other coverage like a retirement plan or union plan or TRICARE or VA benefits, anything that would help to cover Medicare costs. Just keep that in mind. If you are interested in the medical savings account, you can always contact the Medicare Information Office here in Alaska for more information about those options. And last but not least, and my favorite part, because you can say Part D, like drugs, is a Part D, Medicare prescription drug plan. So you must have some part of Medicare, either Part A or B or both, to qualify for a Part D prescription plan. These plans are overseen by Medicare, but also provided by private insurance companies. We currently have 21 different options in Alaska that range in price and coverage. So the best way to compare Medicare Part D plans is based on your current medications, the pharmacy that you like to use, and making sure the plans cover those medicines and work with your pharmacy. There is a tool on Medicare.gov that you can use to compare the different prescription drug plans. You can sort the plans based on the overall lowest cost for the year, or you can look at the lowest premium, the lowest deductible, or different sorting mechanisms to choose the plan that works best for your needs. If you want help with comparing Medicare Part D prescription drug plans, the Medicare Information Office can also help you shop and compare. Keep in mind, if you have creditable drug coverage, which is defined as any other prescription benefits that are as good or better than what Medicare offers, you really won't need a Part D prescription plan. Creditable coverage can be from an employer, a retirement plan, a union. Indian Health Service is considered creditable coverage, veterans benefits. Those are benefits that cover your prescriptions as good or better than Medicare. So that means you would not need a Part D prescription drug plan. You can join a Medicare drug plan when you first become eligible for Medicare during that initial enrollment period, the 7-month window that we talked about earlier. You can reevaluate your plan each year. It is recommended that you check it each year because plans can change or your medicine needs may change. And this is during the annual enrollment period that happens October 15th through December 7th. Any Medicare person can join, switch, or drop the Part D plan during this time. If you make any changes to that plan, the changes take effect January 1st of the new year. The plan can change their list of covered drugs, also called a formulary, They can change their monthly premium, their deductible, and even the amount you pay on each medication at the pharmacy from 1 year to the next. So this is why we encourage an annual checkup, even if you've been satisfied with your current plan. Outside of your initial enrollment period and the open enrollment period, there are other special exceptions where you can also change your prescription coverage with Medicare. These are called special enrollment periods. Some of the most common scenarios include if you move out of your plan service area. So maybe if you move from Alaska to another state. If you lose your creditable drug coverage, if you had good prescription coverage, but you ended employment or you no longer qualify for that retirement plan or the retirement plan ends. If you qualify for assistance with your Medicare costs or other exceptional circumstances. You may have a special enrollment period outside of other times of the year to change or drop your coverage. So keep that in mind. Now, if you choose not to join a Medicare prescription drug plan at your first opportunity, and you don't have other good drug coverage or qualify for assistance with your Medicare costs, signing up later could mean that you pay a late enrollment penalty. Medicare calculates the Part D prescription drug plan penalty by taking 1% of a national base premium each year. The national base premium in 2023 is $32.74. And then they multiply that by the full uncovered months that you were eligible but not signed up for a Medicare prescription plan or had other creditable coverage. The final amount is rounded to the nearest 10 cents and then added on to your plan's premium when you sign up. The national base premium can change each year. It can go up or down, so your penalty may go up or down each year. And also, this is a lifetime penalty for the Part D prescription coverage. The Medicare prescription plan is required to tell you if you have a penalty and what your payment will be. And of course, if you don't agree with the late penalty, there is also the appeal process. You need to fill out a reconsideration request form, which your plan will send you, and you have a chance to provide proof that supports your case. We do want to let people know that there are programs available to help if you have limited income and resources, or you're concerned about being able to afford your Medicare costs. Extra Help is a program that assists with the cost of a Part D prescription drug plan. The Social Security Administration determines eligibility for Extra Help and processes those applications. Applications can be done online through the Medicare Information Office here in the state of Alaska, or by requesting a paper form from the Social Security Administration. There's also a couple of programs administered by our state of Alaska Public Assistance Office. The Medicare Savings Program helps pay Medicare costs, such as Medicare premiums, deductibles, coinsurance, and copayments, those Part A and Part B costs we talked about earlier. This program is also known as QIMBY, SLIMBY, or the buy-in. Medicaid also helps those who have the most limited income and resources, and not only pays the Medicare costs, but can provide additional benefits not covered by Medicare, such as dental, routine vision, those kinds of things. The state of Alaska determines through the Public Assistance Office the eligibility for the Medicare Savings Program and the Medicaid program. If you want to apply for either Medicare Savings or Medicaid, you fill out a paper application that's called the Application for Services, also known as the Gen 50C. This can be provided by the Public Assistance Office or printed from the Public Assistance website. And finally, before we wrap up for the day, let's talk about how you can be effective in helping to protect Medicare against fraud, waste, abuse, and errors. Each year, Medicare loses billions of taxpayer dollars to improper Medicare claims. This puts the Medicare Trust Fund at risk and affects future benefits for everyone. Medicare fraud, errors, and abuse are also affecting current Medicare beneficiaries because they result in higher Medicare premiums and waste money that could be used to increase and improve healthcare services. The Senior Medicare Patrol helps you to avoid these problems by teaching you to prevent, detect, and report healthcare fraud, errors, and abuse. By doing so, we preserve the integrity of the Medicare and Medicaid programs. Medicare fraud involves intentionally billing Medicare for services that are not received or billing for services at a higher rate that is justified. Medicare abuse occurs when providers supply services or products that are not medically necessary and that do not meet professional standards. Medicare fraud and abuse are very similar and many times overlap. To take charge and help prevent fraud, waste, abuse, and errors, follow these 3 important yet simple steps. Protect, detect, and report. Number 1, protect and treat your Medicare and Social Security cards and numbers like a credit card. Don't give out your number to anybody except trusted individuals like your doctor. Scam artists will use your Medicare number to defraud Medicare and the system. If you find your Medicare number has been compromised, you can call 1-800-MEDICARE 24 hours a day, 7 days a week to immediately report your compromised number and request a new Medicare number. Be aware that Medicare doesn't call or visit to sell you anything. And keep in mind, you don't have to talk to anyone who calls or shows up at your door who you do not trust. Be cautious of free medical services. If it sounds too good to be true, it probably is. And pass this information on. Share this information with friends and family to empower others how to prevent Medicare fraud and abuse. Number 2, detect. Even when you do everything right, there's still a chance that you could be a target of healthcare fraud. There are many ways that your personal information can be used without your permission. Record doctor visits, tests, and procedures in a personal healthcare journal, on a calendar, or a notebook. Always review your Medicare summary notices, also called MSNs, and explanation of benefits, also called EOBs. And look for 3 things: charges for something you didn't receive, duplicate billing, or services or supplies that were not ordered by your doctor. Compare your Medicare summary notices and explanation of benefits with your personal healthcare journal to make sure things are correct. You can also access your Medicare summary notices anytime by signing up for that personal Medicare account we talked about earlier at medicare.gov. Third, if you detect or suspect fraud, abuse, or errors, report it. You will protect other people from becoming victims and help save your Medicare benefits. To report your concerns, first, if you have any questions, we always recommend that you be prepared with your Medicare summary notice or explanation of benefits and call your provider of the service to make sure it's not a mistake. We like to give providers the benefit of the doubt. Then call your insurance plan to find out if there was an error that they can correct without taking any further action. If you're not satisfied with the response or not comfortable calling your provider or insurance plan, gather the facts about your situation, make sure you have your Medicare summary notice or explanation of benefits, and any other supporting documentation that show the suspected fraud, abuse, or errors. Then contact us here, your local Senior Medicare Patrol, the Medicare Information Office in Alaska. The services we provide are always free and confidential. Remember, you're the front lines and you can take charge to prevent Medicare fraud, errors, and abuse when you protect, detect, and report. Here's a couple of two very specific scams that we've seen in Alaska lately. Number one, scammers are calling claiming to be from Medicare or sometimes Social Security or the government, and they would like to confirm your information for Medicare to send a new plastic microchipped Medicare card. Medicare is not sending plastic microchip cards. These fraudsters are trying to obtain your Medicare information to bill Medicare for services you don't need or didn't receive. If you receive this call, report it. We report it to the Inspector General for Medicare. We also recommend reporting it to the Federal Trade Commission. Scammers are quick to jump on any changes with Medicare and use the information to try to gain personal information. Scammers call and try to use scare tactics and hurry you. Don't fall for it. If someone calls you and says you need to provide or confirm your Medicare number for any reason, just hang up. Another one we've seen is durable medical equipment, such as back or knee braces. This is another hot topic. These fraudsters are calling folks and asking if they have knee or back pain. If you need a back or knee brace, talk to your doctor. Providing these scammers with your personal information allows them to bill Medicare for braces that are often not even needed. Sometimes they'll send the braces, sometimes they don't even do that. If Medicare needs to contact you, they're going to send you a letter with the information. If you've given out your Medicare number or other personal information, remember, contact us at the Alaska Medicare Information Office, your local senior Medicare patrol. We'll help you plan to take action against these scams and fraud. That concludes my presentation about Medicare benefits this evening. Excuse me. I'd like to give you an opportunity to complete a survey about our office. The survey is completely confidential. It's developed part of our larger analysis of our national program. We did not create the survey and we will not see responses. If you'd like to complete this voluntary survey, it takes less than 5 minutes. It's also anonymous. You're not required to provide any personal information such as name, date of birth, or location. You can go to this link, or you can use your smartphone and scan the code, QR code here is what it's called. And if these options don't work for you and you want to complete the survey, you can send us an email and we can respond to your email with the survey link. The survey asks if it's a SHIP or SMP presentation, and because we are both, you can put in either. It also asks who the presenter was, and today that was Jeanné Larson. There's a few questions on how easy the presentation was to find, how you liked the overall content, and if you'll take any action based on the information provided. If you have a few minutes, we really appreciate if you do the survey. If you don't, that's totally fine, but it helps provide feedback on our program performance and how we can better our education and outreach. So on that note, the end of the presentation provides the contact information for the Alaska Medicare Information Office. We do offer all types of events. If you want to visit our website at www.medicare.alaska.gov, you can find our calendar of events. We do a lot of Medicare 101s on a monthly basis. And we also have a lot of great Alaskanized Medicare materials for your reference. I'd now love to take any questions. If anybody has questions about Medicare and you're watching this recording, you can also reach out to us by phone, email. We'd love to help you with any Medicare related questions or concerns. Thanks again for your time.
Wow, this was great. And there are a lot of questions. So we'll start at the beginning and see how much time we have. Somebody asks, please explain the difference between Medicare and Medicare Advantage.
So Medicare is what we call original Medicare, and that's Part A hospital. Part B medical, administered by the federal government. Medicare Advantage, also called Part C, is another way to get your Medicare benefits, but it's a private insurance company that's handling the administration of those benefits. So rather than the federal government covering your services, it's a private insurance company. And Medicare requires that they cover the same thing as Part A and B. So anything that Medicare covers, the Advantage plan would cover, but the Advantage plan can require different cost sharing. So rather than having a deductible and then Medicare paying 80% and you as the patient paying 20%, the Advantage plan may have a co-payment, a set dollar amount that you pay for each doctor visit. So it's just a different way to get your Medicare benefits. And it's not really been something that we've seen here in Alaska. So it's not an option at this time, though we may see it come back in the future. We never know.
Okay, thanks. Next question. I need dental coverage, yet there are not any providers in Juneau, Alaska, who will accept even a Medicare Advantage policy. What can I do?
So the difficult thing with any insurance is in order for you to use your benefits, you do have to have a doctor or a facility willing to accept that plan. So sometimes you have to get creative. Here in Anchorage, we have the Anchorage Neighborhood Health Center, a federally qualified health center that provides dental care and accepts all types of insurance, or even helps people access services when they don't have insurance for those types of services. So I would encourage you to maybe look for your federally qualified health center in your area. They may provide dental care and accept all types of insurance and even offer benefits on a sliding fee scale. Other than that, you may have to try to convince a dentist to sign up with your respective health insurance and try to encourage your health insurance to contact a provider of your choice and try to get them to negotiate a deal so they become a provider. But yeah, sometimes that's what we call the price of paradise in Alaska. There's not always an abundance of providers willing to accept your given insurance.
Okay. Please discuss Medicare Advantage and out of area coverage for all the Alaska snowbirds. And then the next, what can Medicare Advantage similarly dismiss? Can Medicare Advantage similarly dismiss you without cause? So the first part of that question is out of coverage for Alaska snowbirds and then being dismissed without cause.
So Medicare Advantage plans are very particular to a set network of doctors and facilities, and every Medicare Advantage plan can be different in how they deal with benefits for out-of-network providers. Some Medicare Advantage plans are designed to only stay within that given area of providers. And if you go outside of that network, you run the risk of the Advantage plan saying they're not going to cover the service. The one exception to that rule is when it's an emergency. Regardless of what type of plan you're in or whether the doctor or facility is in the network, if it's an emergency situation, anybody is mandated by federal law to treat you and bill Medicare or your Advantage plan, and then Medicare and the Advantage plan have to cover. But that's only a true emergency where life or health is at risk. Medicare Advantage plans may have like a preferred provider organization, also called a PPO, where if you go in your network, you get the better benefit of your Advantage plan. But if you go outside of that network, the plan may pay at a lower rate. So it's always important to contact your Advantage plan to best understand how they pay out of network. Sometimes your costs may go up, or your out-of-pocket maximum for the year may go up, or sometimes your Advantage plan may not pay at all if you're outside of that network and it's not an emergency. You need to contact your Advantage plan to understand those benefits.
I feel like my eyes are glazing over. This is really so much information. I'm so glad that we have this video so we can go back and, and look at that part and kind of digest that part. And then, okay, so here's another question. Does your office or system support universal health care?
Well, we're really not here to give opinion about politics or coverage. We're here to provide information about Medicare that is authoritative and unbiased. We are here to help people understand how Medicare works, what the benefits are, and how to access those benefits. So I think that everybody should empower themselves to understand how healthcare works, how they can be the best consumer of healthcare. And as a counselor at the Medicare Information Office, I help to empower people to understand and navigate those benefits, whatever they may be.
Okay. What percentage of the time is there upcoding by healthcare professionals do commit fraud with the Medicare system?
I don't have a hard number of the percentage of things that are upcoded. So upcoding is really when, let's say you go in for a cold or flu, and then they upcode it to something that would be a larger payment than what the provider may have been paid for the cold or flu. So they're falsifying information to get a better payment from Medicare. And I don't know what the percentage is of the upcoding. We don't really generally see what the outcome is of most of those concerns. We always act in the assumption that it is potential fraud, abuse, or errors, and then we pass it on to the authorities that further investigate that. And most of the time, we may not even find the outcome because it can take years for the feds to develop a case against a provider who may actually be found guilty of doing that. So I don't have a really good hard number. I can tell you billions, it's estimated that billions of dollars are lost to fraud, abuse, and errors each year, but how that specifically breaks down for fraud, upcoding, errors, abuse, I don't have hard numbers for that. Sorry.
Okay. And then another question, how can I reach the Medicare info office?
So the Medicare Information Office, our slide, if you can see the slides at this time, show our contact information. For those of you that may not see the slide, maybe you're joining by telephone, we have a local number in Anchorage, 907-269-3680. We also have a toll-free telephone number, 1-800-478-6065. Our toll-free phone number only works from Alaska area codes. So if you're calling outside of Alaska or you have a cell phone number that's an out-of-state phone number, you need to call the 907 phone number. We're also accessible by email, which is hss.medicare@alaska, spelled out, .gov, like government, G-O-V. If you contact us by email, just don't include any personal information since email is not a secure portal.
Okay, and the last, it's more of a statement than a question. I guess I'm SOL for orthodontics without first signing up with an Advantage plan and then persuading a dentist to accept what's available.
So most plans, even private insurance plans, rarely cover orthodontic services like braces or correctors. Most, even the robust programs that offer dental services, cover little to no orthodontic treatment. So that's very difficult to find. Most Medicare Advantage plans cover routine dental services and restorative services. And even most of the Medicare Advantage plans across the nation are very limited in that coverage as well. So even though any dental would be better than no dental, at this time, what we have in Alaska is original Medicare. It doesn't provide Medicare Advantage with the additional benefits like dental, vision, audio. most of the plans we see in Alaska that are Medicare Advantage are usually employer sponsored. So they're provided to employees who've retired with their respective employer. We don't know if Medicare Advantage plans will become available in Alaska in the future. We can encourage you to check your Medicare and You handbook. Again, that's the 2023 Medicare and You, and that should be mailed to every Medicare person each year in September. You can also call the Medicare Information Office during open enrollment, October 15th through December 7th, and we can let you know if we see those Advantage plans come back to Alaska.
I wanted to touch a little bit on your volunteers. I had no idea that you guys had this army of volunteers that make Medicare run. That is so cool. I'm wondering if you're having difficulty with that. We're having difficulty with volunteers right now. Is that an issue up there for you guys?
Yes. COVID made volunteering and engaging volunteers extremely difficult. And so our community volunteerism has really declined. We have seen most of our volunteers come from what we call in-kind volunteers. And that's where they're not true volunteers that are doing this with no incentive. It's really that they work for another organization and their job duties require them to know and understand Medicare because of how it factors into their job. So a lot of what we're talking about are volunteers who we train to understand Medicare, but they're doing like supportive services with the senior centers, or they are working for a tribal health organization like Search, or in Anchorage, we've got the Alaska Native Medical Center or South Central Foundation. So they're helping explain other benefits or providing care to individuals. And through that process, they can provide better service by understanding and helping people navigate Medicare. So that's a large part of our volunteer force, are those that are paid by other agencies, but they come to us for the Medicare training. We have a handful of community volunteers who help do Medicare counseling or do outreach or do disseminating materials or staffing booths at health fairs. And so that's starting to come back. There's starting to be a little more interest as people are becoming more comfortable again with being out in public, and health fairs are starting up again and the libraries are open. And so I think we'll start to see more engagement as people become more comfortable with being out in the public again.
Let's hope. I have one more question. Please discuss HE, capital D, capital C, capital E in Ketchikan. Do you know what this person is referring to?
HE, capital D, capital C, capital E.
Yeah.
Is that what I'm gathering?
Yeah.
These are like defined contribution entities or direct contracting entities, I think is the acronym behind that.
Oh, the DCE, she's talking about, please discuss the DC, where there was a typo. Please discuss the DCE in Ketchikan, and DCE is an acronym all in caps.
Okay. Yeah, so I think what the intent in this question is DCE standing for defined contract entities or direct contract entities. And it's a mechanism for Medicare working with certain providers of services in order to help reduce costs in Medicare, focus on patient care, and make sure that there's coordination of care. And it's a payment methodology in Medicare. And we don't get too far into that in the Medicare Information Office because that is a government process that creates contracts between Medicare as the payer of health insurance benefits and the providers of the service delivering those services to Medicare beneficiaries. And the intent behind that is to help reduce Medicare costs, provide the best patient care and outcomes. But we don't really get involved in the provider world as far as like what the reimbursement methodologies are, or how providers become contracted with Medicare. So we don't focus a lot on the partnership between the providers and Medicare. We're pretty out of touch with that world. So I couldn't really talk too much on the direct contract entities. I do know that it is a payment methodology between providers and Medicare.
Okay. I just wanted to say I had no idea. I mean, from a provider's point of view, what did you call it? The upsell, where
Upcoding?
I mean, that would be, I mean, can you imagine you have a provider, they need a little extra money, their kid just went off to college, or they had, and I mean, there's nothing to stop them. There's absolutely, I mean, the idea of getting caught, I mean, it would be so difficult, I guess. I mean, there seems to me there's somewhere along the line, there needs to be some checks or whatever into this, but I didn't really realize it until we were talking about it, you know, when you're answering that question, that I'm surprised there's not more than those billions of dollars. I mean, you know, it's just so. Does anybody else have a question? I have one of our listeners said, thanks for this, very helpful. Is there anybody else that has anything that they want to add while we have anybody? Okay, well, man, it's been great. I mean, you were so professional. Obviously, you do this a lot. And I mean, and when it came to answering some questions, I mean, that were sort of outside of the general scope of things, I mean, your knowledge and your breadth of this is really impressive. I can only imagine how many years it took you to get up to speed, and then all the new rules and stuff. So thank you so much for spending time with us in Southeast Alaska. And we'll talk to you later down the road. Okay.
Thank you everyone for joining, and thank you again, Denny and Aaron and Catholic Community Services for inviting me to present.
Yeah. So, all right, everybody, we'll say goodbye and thank you. By the way, all of these videos are available on our Facebook page. They're going to be uploaded very shortly. So if you want to access that, it'll be available probably tomorrow. You just go to our CCS Catholic Community Service Facebook page and look under videos, and that video will be there. It is also going to be available on YouTube. Just type in Catholic Community Services and Medicare Information Office, and you know, that kind of Medicare 101, those kind of search terms, and it'll come up. So thank you, and we'll talk to you later.
Thanks again, everyone.
All right, bye-bye.
Bye.
Thank you so much. You were great.